And then one bout of skin cancer, that is bad enough, but there's one woman who has had more than 24. We're going to tell you what you need to look for when Dr. Sandra Lee is here, and she'll also tell you how to protect yourself.
25 skin cancers, 25 by the time she was 40 years old. Meet a teacher who learned the hard way about sun protection and early detection.
I just had this little red sore on my arm that wouldn't go away, and it was kind of itchy, and it came back that it was a basal cell skin cancer. So I was probably about 29, I think.
Since then,
I have had probably 25 to 30.
As you can see, she has a lot of scars from her little skin cancer. She's had a lot of them.
And Danelle Buckley is still getting new ones.
I do highly suspect that she has a little basal cell there, and so we're going to biopsy it.
Treatment can involve surgery or just freezing. No doubt about what caused all this.
Combination of getting sunburned many times, and then I don't think that the tanning beds helped.
Wow, joining us now from her practice all the way from Upland. Hi, Sandra. Dermatologist Sandra Lee to talk about this. Now, that woman really has to be unusual with all of that, right?
We do see it. I mean, I've certainly had to take skin cancers off of like even 19-year-old, 20-year-olds, that sort of thing. But it's not as common. I mean, most commonly, these kinds of skin cancers that are not life-threatening, they occur more probably in your 30s, 40s, 50s, 60s, that sort of thing.
And I think people are a lot more aware now. Even my dad at Christmas was saying to my brothers, hey, I got this thing right here. My father never talks like that. Really? So for my dad to step into, what are we looking for?
Well, you know, first I want to say that these kinds of skin cancers are not the life-threatening kind. But you do want to remove them because they are disfiguring. I mean, if you let it grow, if it was growing on your nose and you let it grow, it could take over your nose, or it could take over your ear, or it could get you blind if it was close to your eyes, that sort of thing.
So you can't let it go. You can't say,
you don't want to let it go. And obviously you want to take it off as sooner rather than later, because you don't want to have a big scar or a big area that's missing.
Right. You've had problems, huh?
Yeah, no, I've had a basal cell removed, and I've also had a melanocytic lesion cut out of my back.
Yeah.
That scared me.
A cancer, so it's cancer.
No.
Well, because that's potentially...
So what is a melanocytic?
Melanoma.
Ask the doctor, don't ask me. You know,
he had it.
She's got the MD.
Dr. Lee. He should know what he has.
Well, he's talking about like a mole kind of thing that was a little bit funny looking, but it's not a skin cancer. But if it does turn funny, it could be a melanoma. But it doesn't mean that it was going to become that. It was just atypical. So, but a melanoma is the one that's life-threatening, and that also occurs mainly in the younger time of the life. Like, I think the predominance is in your 30s and 40s.
So
and things.
Very quickly, we're almost out of time. Tell us what you do to treat them and how easy it is.
Off. She brought
this is one of the things that we use. Yes,
freezer.
See,
come on, Jeff.
We can do a little smoke and mirrors here too. Oh yeah, look
Randy,
at how limber he is. Let me see this.
Come here, Randy. Come over around the backside.
Bring it up.
All right. I cannot believe I'm doing this. I cannot believe I'm doing this on television.
Now, explain this, Jeff, because you have had.
I've had this. This was a basal cell skin cancer.
Oh, was it then? So
yeah, and it was burned off.
I think it's just a scar now then.
Okay, go ahead.
I mean, we can freeze it, try to
anyway.
get rid of the brown spot there for you. No screaming, okay? See how it kind of, what we're really doing is just inducing frostbite in that area.
I can tell you
causing
are.
it to turn red and puffy, and it will look worse before it looks better, but it will hopefully lighten that brown spot. But you know, what I really want to drive home is if you have an area, do you see that? Right over her head.
But I mean, you see how simple it is.
Yeah, and if you have an area that bleeds and heals and bleeds again, like maybe you think it's a pimple or a mole, but it doesn't go away and it bleeds very easily, when you hit it with a washcloth, just lightly with your finger, that's something you want to have evaluated.
Okay. All right, so
lots of
watch
freckles,
for that.
no problem.
Watch for that.
Freckles are okay, yes.
I got lots of freckles.
Really, go and see and you should see your dermatologist at least once a year.
Yes, certainly if you're lighter complected too, or certainly if you have a family history.
Okay.
Absolutely.
I mean, I used to lay in my job was at a pool when I was a teenager.
Oh, yeah, and you guys know about the tanning, right? The tanning beds?
Yeah, don't.
There's a new law that you can't go in there if you're under 18.
Under 18. That's
So
right.
at least they're making some changes.
I thought a tan was sexy.
Thank you, Dr. Lee.